Welcome back. Good afternoon. It's 2 o'clock Eastern time. So we're going to start with our public comment section. So at the onset, I'd like to welcome and thank our public comment speakers for addressing the committee today. We view this as an important part of any meeting. All speakers today submitted a request in advance of the meeting, and the final list of public commenters was determined via a lottery. For the speakers specifically, we have a limited public comment period, and in order to make it through all of the listed speakers, it is extremely important that each speaker limits his or her remarks to 3 minutes. There will be a timer on your computer screen that will cycle through different colors, indicating how much time you have left. At the end of the time, it will indicate your time has expired. At that time, I will say thank you for your comment. Your time has expired. Should you extend your comments by 15 seconds, I will state, as a courtesy to other speakers, we ask that you conclude your comment. And if you continue for 30 seconds total past the time you are allotted, your microphone will be cut, and I will make the statement, your comment time has expired. Thank you. So we will begin. Our first speaker is Mrs. Finch, and please state your full name when you come to the microphone and the organization that you represent. Mrs. Finch.
Hi, good afternoon. My name is Alicia Finch. I represent Parents Protecting Education. Good afternoon, members of the Advisory Committee on Immunization. My name is Alicia. Thank you for selecting me to relay concerns from colleagues and parents in my community. Before I begin, I'd like to thank the Center for Disease Control and Prevention for diligently working to resolve the pandemic's devastating consequences on our global community. Your steadfast scientific work is essential to promoting a lasting solution to the challenges the U.S. and other governments face to building a healthy community. Today, I speak on behalf of the parents who are skeptical of resolving this challenge by mandating a vaccine. While we are aware there is large numbers of communities who desire this vaccination, there's also a large community who desires the ability to choose a sound medical decision based on each child's medical needs. The CDC's recommendation has a great influence on our local, state, and federal government's decisions to mandate vaccinations for our nation's children. I plead for the consideration as a mother responsible for the well-being of my children. My husband and I are committed to raising our children using a mindful and educated decision-based approach to health. The benefits of this vaccine may be great for one family and not for others with medical conditions. The facts are that that these vaccinations, despite their positive intent, are too new to understand the lasting effects on our community's children at large. Clinical trials have not had the time to gauge the long-term effects on the development and the growth of our children. And for this reason alone, we ask you to recognize in your decision-making that communities with significant medical challenges need and should be able to require a choice as far as the mandating or the requirements of this vaccine go in our communities. I thank you so much for your time and consideration today.
Thank you for your comments. Our next speaker is Mrs. Starkey White. Please go to the microphone, Mrs. Starkey White.
Yes, my name is Savannah Starkey. I am representing my son, baby Remy. I'm an individual. Thank you for the opportunity to speak today. In February of 2020, I stood in front of you and I spoke on behalf of my son, baby Remy. I'd like to honor my son today by speaking about the topic at hand. Baby Remy passed away approximately 12 hours after his CDC recommended schedule at his 2-month appointment. His autopsy came back anaphylactic adverse reaction to the multiple vaccinations received the day prior. The current schedules have been approved for decades, and we still have thousands of infants, children, and adults dying and suffering as a result of them. I can't emphasize enough how important it is to truly know all of the adverse effects of a vaccine, no matter how small you might consider it. To you, my son was just one baby, but to my children, my husband, and myself, he was our world, and it is forever shattered. Pfizer is filing for the full FDA approval of their COVID vaccine later this month. It's no secret that the vaccine comes with significant immediate reactions. The list of adverse reactions are growing and the numbers of complaints are tripling daily. We do not know enough about the long-term effects of this vaccine to approve it for full FDA approval. Based on the limited study that you all conducted yourselves, 77.4% reported at least one systematic reaction. Lymphadenopathy, Bell's palsy, appendicitis, acute myocardial infarctions, cerebral vascular accidents were all reported and considered adverse reactions just from your studies alone. There have been thousands of additional reports to VAERS for serious adverse reactions, blood clots, nerve pain, rashes, hives, multiple deaths, and dozens of others are trickling in. Concerns of infertility are rippling through social media and flooding doctors with concerned patients. We do not know the long-term effects of this vaccine. We will not know this for 5, 10, or even 20 years. This information is critical and it must be known before the FDA approves, especially for our children. Our children are our future. We have to protect them by not jumping the gun. America is looking up to you to do the right thing. I challenge you to advise the FDA to deny the full approval of the Pfizer vaccine as it stands right now. Thank you.
Thank you for your comments. Our next speaker is Mrs. Olson. Mrs. Olson. Let me come back to Mrs. Olson. Mrs. Sullivan.
Hi, I am Janelle Sullivan from Heartline Foundation. I have a son who is recovered from severe autism. I spoke in front of this panel in the past about how I've recovered him. Autism Beyond Despair was a book that was very helpful. It actually has a chapter as a rebuttal to Paul Offit's book, Autism's False Prophets. I recovered him doing what Paul Offit says not to do. This panel likes to pretend that anti-vaccine families are child abusers to autistic kids. Your CDC schedule caused my son to bang his head on cement to bleed, to have absentee seizures. It is guilty of the worst child abuse on this planet. And I seriously fear what your recommendations are going to cause. You have the power today to say no. You have the power. It is so much easier for you to do this now than it will be. You will not be able to take this decision back. It's going to affect so many lives. These children are not affected from COVID. They are affected from your lockdown measures. They are affected from masking, from social distancing, from not receiving the contact and the love and the hugs and the high fives that were meant to be given and received. Our hearts are not meant to be kept separate. They are meant to come together and do great things. And they are also meant to heal. And they don't need you putting all of these poisons in our bodies. We need to have the ability to say no. Your recommendations, your schooling has encouraged doctors to say things like, you can't breathe around the unvaccinated. My father-in-law was told that, and he stayed away from me for 3.5 years. My child had a seizure following his last vaccines. And people request that he not be invited to parties. People that my husband was in their wedding parties of keep their children away from us. You guys are doing to us just what the Germans did to the Jews. They said that they were guilty of spreading diseases. I see you. I see what you're doing. And I'm telling you, because of what you're doing, more people are listening to me than ever before. More people are coming to our side. Please stop this now. Thank you.
Thank you for your comment. Let me go back. Mrs. Maya Olson. We'll come back. Ms. Lindsey Mayer. Let me go to the next speaker, please. Ms. Susie Olson Corrigan.
Hello, can you hear me?
Yes, we can.
Okay. Hello, my name is Susie Olson Corrigan. Thank you for the opportunity to speak once again today. I realize we have limited time, so I'm just going to highlight a few points really quickly. One of three of my main issues with this COVID-19 vaccine is the fact that implications of fertility impairment have not been studied. So how can we recommend a vaccine to 12 to 15-year-olds that could potentially cause impairment in their fertility? Why weren't these studies done prior to recommending these vaccines? These studies need to be done now, and parents need to be given informed consent. Prior to be given the administration of these vaccines, they need to be told that these studies were not done. Combining vaccines. One of the primary questions today
Thank you. Yes. Can you hear me okay?
We have a current speaker at this time. We will call you in a minute. Please continue.
Okay, can you hear me?
We can. Go ahead.
Okay, so combining vaccines. One of my primary questions today was in the regards to safety data and co-administration of the mRNA vaccine simultaneously with routinely recommended adolescent vaccines. After listening to the ACIP meeting today, it is clear that these studies have not been done. Yet I keep hearing that in the absence of data, you will still recommend administration of the mRNA COVID-19 vaccines along with routinely recommended vaccines. Adolescents are going through things that adults are not. Hormonal changes during puberty and brain development should be closely looked at and studied prior to any administration of these vaccines. In the absence of data, ACIP should not be recommending this vaccine. Today, I heard about deaths. We heard that 127 deaths were attributed to COVID-19 disease in 12 to 17-year-olds. However, since we are discussing the interim recommendation of COVID-19 vaccine for 12 to 15-year-olds, I'm highlighting just that data, which is needed to make this decision today. Deaths by age, according to CDC, says that we have had a total of 17 deaths in 12-year-olds, 13 and 13-year-olds, 15 and 14-year-olds, and 24 and 15-year-olds. That is a total of 69 deaths that have been attributed to COVID-19 in 12 to 15-year-olds. While the loss of any life is tragic, especially in children, we have to look at this and declare there is no emergency for children in this age range. How can you, the members of ACIP, whom are entrusted with making these decisions, recommend this vaccine based off of this data?
Thank you very much. Let me go back. Ms. Maya Olson, Mrs. Maya Olson, excuse me. Right. Ms. Lindsey Mayer.
Yes, hello. My name is Lindsey Mayer with Informed Choice, Iowa. I'm here today as also from a virology perspective. My background is in virology. I studied at the University of Iowa. It has been well documented and demonstrated that kids are at extremely low risk of serious illness from COVID-19. In comparison, around 600 children died in the influenza season of 2017 and 18, which you reflected earlier in your hospitalizations, in comparison to 282 deaths in children related to COVID. This despite already having a widespread influenza vaccination campaign in America. Quite frankly, it does not matter how efficacious this vaccine is in stopping illness in children, considering how few children are ever actually seriously impacted, and considering a primary concern, the risk of asymptomatic transmission, was not even evaluated in this trial. So why are we not practicing needs-based medicine? Will we be doing more harm than good, considering children have a 99.99% survival rate from COVID and have demonstrated they are not a primary source of transmission in this pandemic? The Pfizer vaccine has already been associated with 1,719 deaths, according to the passive reporting system VAERS, which we know grossly underestimates the true numbers, given both the FDA and Department of Health and Human Services have published studies on this. Yet here we are today discussing data that hasn't been seen or analyzed by the public, hasn't looked at asymptomatic transmission, lacks data in those with underlying health conditions, or data on co-administration of this vaccine with others on the schedule. And still this body plans to vote on emergency approval for which there isn't even an emergency in children. Finally, Pfizer has again failed to test its product in a cohort that truly represents the U.S. population of children. A 2011 study found 54% of our nation's children have a diagnosed chronic illness. In the adult trial, only 10% of the total 46,000 participants who received the vaccine had a chronic illness, with no autoimmune conditions represented in that group at all, and the rest fall under the definition of tyranny of small numbers, as does this trial. It failed to enroll representative numbers of those with underlying conditions. Yet this group plans to roll it out to all 12 to 15-year-olds regardless of what their health is like. How can you confidently say this isn't going to significantly harm them, more so than benefit them? How can you say this is safe when you do not know what the chances of from them developing a new onset chronic disease, cancer, fertility issues, hospitalization, disability, or death as a result of taking this experimental vaccine that was only tested in 2,620 participants? It's clear that children's well-being is not the priority in approving this authorization. Irrational recommendations will do no good, will certainly cause harm, and further discredit our federal health agencies. You do not gain public trust through quickly approving experimental vaccines that will eventually be forced on millions of American children in order to attend school. You will only increase those who distrust the entire public health industry, as well as the entire recommended schedule. So go ahead, vote yes if you want to increase vaccine hesitancy for an unnecessary product for a situation that isn't a true emergency, or vote no and get your questions actually answered. Thank you.
Thank you. Ms. Allison Winicky?
Hi, good afternoon, Chair Romero and members of the committee. My name is Allison Winicky, and I am President and CEO of the Immunization Partnership. Our nonprofit mission is to eradicate vaccine-preventable diseases by educating the community, advocating for evidence-based public policy, and supporting immunization best practices. Thank you to the committee and to the COVID-19 vaccines work group for your tremendous work during this pandemic, reviewing scientific data and developing vaccine recommendations to keep all Americans safe and healthy. Your scientific recommendations are an important tool that states use to carry out their constitutional duty to protect the public's health. As we move into vaccinating adolescent populations against COVID-19, we are observing that hesitancy among parents has been amplified, even as compared with those parents' own comfort in receiving their adult COVID-19 vaccine. And it's understandable that parents may have additional questions or fears regarding COVID-19 vaccines for their children. We've observed many questions and concern regarding these vaccines' impact on hormonal changes, reproductive issues, allergies, and potential long-term effects when administered to adolescents. And so it is critical that trusted messengers proactively share medically accurate and culturally appropriate information with these parents to address these issues before they fall victim to misinformation and disinformation spread online. We can build trust and comfort through dialogue, listening to concerns, explaining the latest peer-reviewed data, and meeting them where they are, whether physically or emotionally. As presented today, a recent survey indicated that 74% of parents would feel comfortable with their child receiving a COVID-19 vaccine in their regular provider's office, as opposed to other venues such as pharmacies or vaccine clinics. So we should take heed of these parental preferences, and states should rapidly enroll pediatricians and other adolescent healthcare providers as accessible COVID-19 vaccine providers. At the same time, we need to promote health equity and continue to offer accessible vaccine administration sites for those who lack a regular medical home and those who continue to experience barriers to access. It is imperative that we increase our lackluster immunization rates by increasing demand for these life-saving vaccines. As we expand our COVID-19 vaccination efforts into the adolescent population, I recommend a multi-pronged approach, proactively addressing parental questions, incorporating parental feedback and best practices to increase confidence, and continuing to expand access to trusted vaccination locations. Thank you so much for your important work and the opportunity to share our comments.
Thank you very much for those comments. Our next speaker is Mr. Richard Robbins. Mr. Robbins.
Hi, thank you very much to the committee. My name is Richard Robbins. I'm speaking today as a parent of 13 and 15-year-old daughters, and thus have a vested interest in your decision. After the FDA gave its authorization for 12 to 15-year-olds on Monday, I went to the ACIP website to see how quickly my daughters would be able to get vaccinated and saw that there was an opportunity for public comments prior to today's vote. I thank you for this opportunity. On behalf of my daughters, who are eagerly awaiting the opportunity to get their vaccines and return to some approximation of normal life, I strongly recommend that you vote in favor of approving the vaccine for 12 to 15-year-olds today. I recognize that there is irony in my recommending that you listen only to scientists, as I am not a scientist, but the overwhelming recommendation of doctors and scientists is that the vaccine is safe and effective. Pfizer's trial results are nothing short of miraculous. As you know, the phase 3 trial demonstrated 100% efficacy and robust antibody responses among the half of the 2,260 adolescents who received the vaccine versus 18 cases in the placebo group. Further, the trial found that the vaccine was well tolerated with limited side effects. On the other hand, even if the risk of COVID is lower for adolescents than for the elderly, it is still a serious and risky disease. A recent article by Dr. Kristen Moffitt, pediatric infectious diseases doctor and researcher at the Boston Children's Hospital and an assistant professor of pediatrics at Harvard Medical School, reported that over 400 children have died from the COVID infection, more than the number of childhood deaths during the deadliest flu season in the past 2 decades. Further, in the New Scientist, Helen Thompson wrote of the first study of long COVID in children. It found that nearly half of children with both symptomatic and asymptomatic COVID-19 are experiencing long-term effects, many months after the initial infection. More than half of children aged between 6 and 16 years old who contracted the virus have at least one symptom lasting more than 120 days, with 42.6% impaired by these symptoms during daily activities. As my daughters can attest, young people have endured many hardships this past year. This meeting is a good example of how Zoom is an imperfect replacement for live in-person interaction, especially for school children. It is important that children are able to safely resume going to school, seeing friends, and having some approximation of normal life as soon as possible. It is even more important that in doing so, they do not risk transmitting the virus to older family members who are even more at risk. We need to do everything we can to get as many Americans vaccinated as soon as possible. This is an important step. Thank you for all the work you are doing. I look forward to your vote, and assuming you approve, look forward to taking my daughters to get vaccinated tomorrow, but nowhere near as much as my daughters look forward to getting their shots.
Hi.
As I am the last speaker before discussion of the vote, I will conclude so I don't slow things down anymore. Thank you very much.
Thank you very much for your comments. We have one more speaker, Mrs. Mia Olson.
Hello, thank you, and I'm sorry for the technical difficulties earlier. Good afternoon, and thank you for your time. My name is Maya Olson, and I'm from South Dakota. I'm commenting today for myself, along with the millions of parents who are protected by the Nuremberg Code, which states, the experiment should be such as to yield fruitful results for the good society, unprocurable by other methods or means of study, and not random and unnecessary in nature. Right now, we know that there are other methods of treatment for COVID-19 that are successful without death as an adverse event. The Nuremberg also states, no experiment should be conducted where there is a priori reason to believe that death or disabling injury will occur, which we also know is tragically not the case, as your very own reporting system has reported 11 deaths associated with the COVID-19 vaccine since granting emergency use authorization for 16 to 18-year-olds a little over a month ago. Your own Paul Offit stated in an interview that it would be a mistake to put out to the American public a vaccine that was only tested in a few thousand people, which is what we're doing right now. Your trial for this age group had very small enrollment population in a very short time frame, and there were severe injuries within the trial. Just this past week, a 15-year-old in Colorado died after receiving the vaccine. You are currently charged with approving a vaccine for the children with no long-term studies, with over 1,700 deaths associated with this vaccine as per your own reporting system. Allowing this vaccine to stay on market is unprecedented, as the FDA pulled the rotavirus after far fewer deaths. Not only that, but Pfizer has pled guilty to a felony violation of the FDA for misbranding with the intent to defraud or mislead. What is to say that isn't happening again? The children aren't at risk for this disease. Per the CDC, there were 69 deaths for this age group. Why is it that you are asking them to carry the burden of a society on their shoulders? I ask that you do not approve this vaccine without further long-term studies. I mentioned a quote from Paul Offit earlier. I will now quote from the governor of my life. Luke 17:2. It were better for him that a millstone were hung around his neck and he cast into the sea than he should offend one of these little ones. Please don't vote to pass this.
Thank you for your comments. That ends the public comment session at this time. We will take a recess until 15 minutes till the hour. We'll reconvene at that time.